Welcome to Rumor versus Truth, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. Today, we'll break down FDA's recent announcement about new pregnancy warnings for acetaminophen.
Don't take this the wrong way, Don, but it's weird to see you off schedule like this right now.
Yeah, I know we're used to recording our Rumor vs. Truth podcast episodes on certain days, but we wanted to address the large number of questions we received about FDA's recent announcement about new pregnancy warnings with acetaminophen, Tylenol, that have made the news.
And before we dive into the evidence, I'm Steve Small, PharmD, a pharmacist here at TRC Healthcare.
And I'm Don Weinberger, PharmD, also a pharmacist here at TRC Healthcare.
And in this episode, we're trying something different. Instead of our typical setup of 4 to 5 claims, we're going to do a deep dive on a single claim. We're calling it Rumor versus Truth Quick Verdicts.
Yep, short, focused, and in this case, very topical with what's making headlines. And folks, we know our show typically has some puns and light banter, but for this one, we're going to keep it very straightforward to be clear in our guidance. So with that...
Yeah, the claim on everyone's mind right now is acetaminophen in pregnancy causes neurologic disorders in kids, things like autism. Now, as you've probably heard, FDA announced on September 22nd that they've, quote, initiated the process for a label change for acetaminophen, Tylenol and similar products, to reflect evidence suggesting that the use of acetaminophen by pregnant women may be associated with an increased risk of neurologic conditions such as autism and ADHD in children. ADHD meaning attention deficit hyperactivity disorder.
Right. So, Steve, what's the evidence here? This is a huge claim, right? Considering autism spectrum disorder has been identified in about 1 in every 30 kids who are 8 years old.
Right. This might seem nitpicky here, but it all boils down to the use of the word cause in this claim. The FDA even says in their announcement, quote, a causal relationship has not been established, and there are contrary studies in the scientific literature. And to back up here, there are studies that do suggest a very small association between acetaminophen use in pregnancy and neurologic issues in children, such as autism. But this association was only shown with long-term chronic use, such as over 1 month, not as needed short-term use. And keep in mind, Don, these studies were not randomized placebo-controlled trials. This data is mostly animal studies and observational studies in humans.
Sure. So back up. So observational studies, right? That's when we watch a group of people and look at what they've been exposed to in everyday life, in this case, acetaminophen, right? And see if they have an increased risk of a certain outcome. Again, in this case, autism. Very different from a randomized placebo-controlled trial.
Very different. And here's the kicker. The observational studies cannot and will not determine cause. They're not designed to do that. They can only show an association based on their design.
Yeah, important, yeah. Plus, observational studies can have important limitations from confounding and bias that may cause the results to be over or underestimated.
Very true. And we should say, for our listeners who aren't familiar with terms like bias and confounding or general statistics, we have a great resource, Glossary of Study Design and Statistical Terms to help you out.
Yeah, I'm really glad you pointed that one out. So this resource defines confounding factor as additional factors that distort the interaction between the treatment and the outcome. So a good example of this is that high fevers in pregnancy are also associated with neurological conditions in kids, and acetaminophen is commonly used to treat fevers. So how could we tell which is contributing to the outcome?
Yeah, and a bias is a flaw in the design or operation of a study that leads to results that are not the truth. For example, many of these studies had moms self-report if they took acetaminophen months prior in pregnancy. And this is a flaw because if their child had a problem, perhaps, they may be more likely to remember that they took acetaminophen. And we call this recall bias. Great example.
Yeah, I know. Speaking of that, needing to look back and remember when you took something as difficult just on its own, recalling myself, if I took acetaminophen in the past 3 weeks, I couldn't tell you.
Right.
Maybe. I'm in the dose, I couldn't really tell you. So this actually pokes holes in a lot of that data.
And to add to that, there are a couple observational studies that try to control for some of these issues, and they found no risk with any acetaminophen use. So, really conflicting data here. For example, a 2024 study looked at over 180,000 children exposed to acetaminophen in pregnancy. And when they accounted for some of these biases we're talking about by using siblings as a control group, they found no difference in rates of autism and ADHD. So, with that in mind, let's go back to this claim here that acetaminophen in pregnancy causes neurologic disorders in kids such as autism and ADHD. The verdict is rumor with conditions. We don't have evidence that acetaminophen causes autism or other neurologic conditions in kids. Instead, we've only seen an association. We need randomized, placebo controlled trials before we can say it's a cause because there are so many variables we need to control for.
All right. So viewers and listeners are, I can read their minds, are likely asking, how does this change how we use acetaminophen?
Right. Well, acetaminophen is still the safest pain med option we have in pregnancy.
Mm.
FDA said in their letter to physicians, quote, clinicians should consider minimizing the use of acetaminophen during pregnancy. So we should only be using acetaminophen when necessary, using the lowest dose and the shortest duration needed.
All right. So isn't that how we always used acetaminophen in pregnancy?
Good point, Don. I've worked in obstetrics most of my hospital career,
Yeah.
and this is how we honestly try to approach every medication in a pregnant patient. So, this frankly doesn't change a thing to me when it comes to actual practice, to be totally
Right.
honest.
Yeah. And I agree with that. And we can use a multimodal approach to pain management to minimize risk to the fetus. Starting off with a non-drug approach, like hot or cold packs or physical therapy, can minimize medication exposure in general.
Yeah, and if that doesn't help, we can use topical products like lidocaine or menthol medications, but we should avoid topical NSAIDs like diclofenac or methyl salicylate that you might find in
Mm,
muscle rubs because these can be absorbed and have fetal risks such as kidney
mm,
defects and even cardiac issues. So keep that in mind.
Yeah, yeah, good point. And if those don't work, that's where I feel we can crack out that as needed acetaminophen,
Yeah.
and reserve acetaminophen for fevers that are 100 degrees Fahrenheit or higher. As we said earlier, higher temps and mom may harm the fetus.
Yeah, and to reiterate what we said earlier, generally steer away from oral and topical NSAIDs, things like ibuprofen, diclofenac, and even high doses of aspirin. They have stronger evidence for adverse fetal effects we need to avoid. We've got the data there.
Yeah. And there's lots of great info out there. We also have our great charts, analgesics in pregnancy and lactation, and topical medications in pregnancy and lactation to help you compare options while balancing benefits and risks.
And a quick tip to our folks working in the hospital, don't jump to removing acetaminophen from labor and delivery order sets. See if you need to make tweaks, though. For example, in pregnant patients, make sure the orders default to as needed instead of being scheduled around the clock. And ensure that they have clear instructions for use to make sure we're using them judiciously. Also, after delivery, know that it's typically okay for moms to get scheduled acetaminophen around the clock because we know
Mm.
it helps decrease the need for opioids, which have their own known set of risks that
Yeah,
we want to avoid.
right. Great call out to hospital people there. So with all that being said, the bottom line truth really is acetaminophen is still the safest pain medication option in pregnant patients, but it should be used like any med in pregnancy, only when needed at the lowest dose and shortest duration possible.
Couldn't have said that better myself, Don. And a reminder here, what we share here on our podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. So essentially, pregnant patients should talk with their prescriber first before using any medication in pregnancy.
Yep, good call out. And pharmacy staff are often the first point of contact when patients hear scary headlines, especially in the case with such a common OTC medication. This is a great opportunity to clarify what the evidence really says and help patients make informed decisions.
And we at Rumor versus Truth are here to help you do just that. Let's not forget that patients are bombarded by tons of conflicting info out there. We have a great resource discussing medical misinformation to help them unpack and debunk claims they may encounter on social media or from family and friends.
Yeah, you can also read more about the evidence behind acetaminophen's pregnancy safety in our early release article in Pharmacist Letter and Prescriber Insights online. We've linked directly to that article and all the resources we've mentioned in the show notes for this episode.
And in a world full of conflicting headlines, TRC Healthcare is here to help you cut through the noise. Whether you're a pharmacist, a prescriber, or technician, our tools and articles are built to support confident, evidence-based decisions. So subscribe today with promo code RVT1025 at checkout to get 10% off as a listener to our show.
And stay tuned for our next regularly scheduled episode, Dental Dilemmas, where we will bring you multiple claims about meds affecting oral health. And don't worry, we're also bringing back the puns. Thank you for joining us on Rumors is Truth, Quick Verdicts, your trusted source for facts, where we dissect the evidence behind risky rumors and reveal clinical truths. See you next time.